challenge. Okay, you're welcome. And now I go back to our first patient. And once again, this patient has a normal step on one side. Which side was it? Yes, this one. Yes, on this side, the step was good. Okay. One foot forward, please, and one arm forward, please. Push. Very good. Arm forward, push. Very good. And the second foot. This is wonderful, a great step. And this is where the overexcitation persists. This is where I'm going to look for the problem with the information source. I'm looking at the problem in the autonomic nervous system. In the somatic nervous system, she had a problem on the left foot level when she was standing on her left foot and she had her foot up. Please stand like this and place one foot like this. This is how she stood. It was fine. And when she stood on the other foot, there was a problem here. Do you remember? I want to see right away if the problem is with the left foot. I take this coaster, this foot step, and yes, this footrest, and I'm looking at the foot where there is down. And I place the footrest under her foot and I see if anything changes. And we go back to the stepping pattern and put the foot here. Look, push. This is good here, and this is where, yes, we have restored this step. So this is the problem with the muscles in the left foot. I now want to check if I got everything right. Please take your foot off the footrest and put your feet evenly next to each other. And I remember that she had a raised shoulder right here, and I raised her foot like this, only the foot arch, and I look that I see that the shoulder goes down gradually. This means that the problem in the cervical spine had to do with the foot arch, and I'm going to work with the foot muscles, and I'm going to look at this in the next step. Please sit down. You remember that our patient had a problem with the stepping pattern on both sides. When she put her foot on the right, normally this muscle should be normal and this arm should be weak, and this is what I want to find out. I want to see if the emotional effect is not strong enough, and maybe there's some other structure that needs to be fixed. I put my hands on the frontal eminences here, 2 fingers, and I see if what I've done is enough. If it's not, then the stepping pattern will be restored. This stepping pattern is not restored, and I see that maybe the problem is because I have not finished working with the thoracic diaphragm. Please place your magnet on the diaphragm, and I'm looking to see if I have not fixed something here. Maybe I have not fixed something here, and I do the magnet challenge, and I look at the problem here. There is something that is not done here. Maybe the liver, maybe I have not fixed the liver. So there's something wrong with it. What is it wrong? Please remain standing as you have been before. And I'm looking at the liver. What if I try and fix the liver? Will it restore the function? Not like this. And what if I act on this side? We looked at the right triangular ligament and the left triangular ligament and push here. This means that I need to fix the left triangular ligament. Only this will help me restore the stepping pattern. This means that the emotional problem caused the thoracic diaphragm to spasm. This caused the problem with the liver because the diaphragm went down on one side. I have fixed it, but the ligaments of the liver were not elastic enough, and they need to be fixed. They need to be fixed on the left. I have the patient sit down on the couch. I have the patient bent towards me. I position one arm in front and the other arm at the back. Now I move the patient to the left. You know the law of the visceral therapy, that it's not about us doing the movement inside the internal organ, but rather we have the organ push against our hand. This way it's not painful for the patient. I shift her body onto my hand, and now I turn the body and inhale and inhale. And please remove your hands and relax, and once again, and even more, and slightly less. Okay, fine. And now relax, please. Inhale, inhale onto my hands, push against my hands, and exhale like this. And I'm going to work here very quietly, very carefully. Can you see she's working herself, and I'm only fixing the organ? And exhale now. How is your pain? It's better. Inhale, exhale like this. I'm going to turn you a little bit, like this. Inhale and exhale like this. That's good. Inhale and exhale. And now try inhaling and arching your back the other way. That's right. That's what I need. Good. And now try to do that on the other side. Yes, this is good. Do you feel the pull? Yes, I do. And good. And now please exhale again. I'm not doing anything with my arms and hands. I'm just working using my legs and her torso. Please inhale and exhale and arch your back. I want to challenge her. How is your pain now? It's much better. I want to see if I did a good job. I ask the patient to stand in the stepping pattern and please this foot forward. And I'm looking at the muscle which should be weak normally. And I'm looking whether it's weak or not. That's very good. Can you see now? This is how you